Okay, next, I'm going to hand it over to Kip, and we'll have an update on EOC operations and also intergovernment relations update and a communications update. So thanks, Kip.
Thank you, Dave. Good afternoon, Mayor and City Council and members of the public. I'm Kip Harkness, Deputy City Manager, and along with Lee Wilcox, the Director of our Emergency Operations Center. So on behalf of all the city staff and nonprofit partners working together in our response to COVID-19, I'd like to give you an update over some of the key events over the last month. As a reminder, in addition, we did hear the vaccines last week, so we'll be touching on that fairly lightly this week. And there are 3 separate items related to COVID that Council will hear later: the extension of the proclamation of local emergency, a preliminary operational assessment report, and a ratification that deals with land use around vaccine clinics. So those will be dealt with as separate items. So for us, some highlights from the work in February include the work of the Child Care Branch, which continued to increase enrollment for their Rock and Learn centers, which the session 8 began during this past month and had 431 children enrolled across 38 separate cohorts. The Emergency Interim Housing Team worked with the county and site operator at the Roof of Ferrari site to begin sheltering homeless individuals and couples. The site is currently sheltering about 98 seniors and COVID vulnerable individuals. Habitat for Humanity has reached 90% construction completion on the Evans Lane community, with the site expected to open by about mid-March. Light touch on the vaccination team. They are supporting a vaccination event in partnership with Aki out of the Moore Park Clinic, including door-to-door canvassing and logistics support. Mailers are headed out to all of the housing department's mobile home parks, and phone banking efforts continue to reach vulnerable seniors in multiple languages. We also continue to work with the providers to secure new clinic sites and hope to announce a new site relatively soon. The digital inclusion team completed outdoor Wi-Fi networks located at 17 libraries and community centers, and all networks are now operational. And as was mentioned in the orders of the day, the Emergency Rental Assistance Team just got on Thursday U.S. Treasury Department advisory and guidance for the program. And so staff has been working since then over the weekend to incorporate the new requirements into program development and an operational approach, and will return to Council next week on March 9th with a recommended approach for that very important emergency rental assistance program. From the Food and Necessities team, over 8 million meals were served so far in San Jose in the first 2 months of 2021. Big thanks to Second Harvest and all of our many community partners who are out there doing that work. We made sure there was additional meal distribution in partnership with the County Office of Education during the spring breaks, and we'll continue to do that during all of the subsequent school breaks. And we've had a large number, several hundred volunteers sign up through Silicon Valley Strong to assist with food distribution and vaccine outreach. We also have over 18 business partners currently recruiting from their staff additional volunteers to support with food distribution and vaccine outreach. So just now, while we were in this meeting, following the state of California's announcement that Santa Clara County has met the requirements to move into the red tier of the Blueprint for a Safer Economy, the County of Santa Clara Health Officer announced today that the county will align with the state's framework and allow activities open in red tier counties to resume effective tomorrow, Wednesday, March 3rd. The following changes are effective Wednesday, March 3rd. All activities authorized under the state's red tier, including indoor dining, can resume in accordance with the state's capacity limits and safety protocols, including the following: indoor dining at a maximum of 25% capacity or 100 people, whichever is fewer. Retail stores at a maximum of 50% capacity. Gyms and fitness centers at a maximum of 10% capacity. Movie theaters, 25% capacity or 100 people, whichever is fewer. And zoos, museums, and aquariums at 25% maximum indoor capacity. Sector and activity-specific local directives will no longer be in effective, but the mandatory directive on travel will no longer be in effect. We'll provide an update out to Council with that complete information shortly, and community. As you know, vaccine eligibility is expanding, and with more expansions coming in the next 2 weeks. So starting on Sunday, the rest of Phase 1B, including those working in food and agriculture, education and childcare, and emergency services, including many of our field staff in the city, became eligible for that vaccination. We are communicating starting this past weekend to city employees to notify them of their eligibility, and have followed up with counties and other cities to clarify who is qualified and who's not. It's a pretty broad net, and we're making sure that everybody who is eligible knows that they're eligible. In addition, starting March 1st, all unsheltered individuals are eligible for vaccinations. Valley Homeless Healthcare Program is working on a plan for getting out to encampments. And however, their first focus will be on providing vaccinations at the congregate shelters because of the higher risk at the shelter areas. And so all homeless individuals are now eligible for vaccines, and that program is underway under the leadership of the county. Starting March 15th, people ages 16 to 64 who are deemed to be at the very highest risk for morbidity and mortality from COVID-19 will be eligible. There's a range of conditions on that eligibility, and there is, of course, some medical discretion that's allowed to qualify who within that category of 16 to 64 with pre-existing conditions is eligible. So right now I want to turn it over to our Bennett Chang, who is our Director of Intergovernmental Relations, to give us an update on the work that's going on in Washington in particular, and around the American Rescue Plan, which will be probably our last big funding effort and will be the impetus and the main thrust of our work around community and economic recovery. So Benna, please take it away.
Thank you, Kip. Good afternoon, Council. Benna Chang, Director of Intergovernmental Relations for the City of San Jose. Kip, next slide, please. Here, as Kip mentioned, just to provide a quick update on the next federal stimulus package. Before I start, I just wanted to highlight two key takeaways that I hope you get from today. First is that this package is not yet final. The Senate is going to go through its negotiations process, and we do expect changes. And then secondly, this, as Kip mentioned, this is likely the last stimulus bill, especially for local government funding. So whatever we get from this package must last us through the end of recovery, which is likely to take several years. So as you have heard, this Saturday, the House passed the $1.9 trillion American Rescue Plan, mostly along party lines. Their intent through this package was generally to fund existing programs versus starting new programs, which takes a little bit more time to start up. So the idea is to fund existing programs and to get the money out faster. Starting this week, the Senate will take up the House passed bill and will make changes to the package that will then go back to the House for concurrence. The goal is to pass the package by March 14th, when certain elements of the December stimulus package, including the pandemic unemployment benefits, expire. Next slide. So this next slide lists some key elements of the House package that would go directly to our residents, businesses, or to the city. The package includes several priority areas for the city, including emergency rental assistance funding, homeless program funding, childcare assistance, and airport funding. Of particular note, the House package also includes $350 billion for state and local governments. We have seen different estimates on what the City of San Jose will receive from the House Committee on Oversight and Reform, but generally those figures are in the $200 million range. The final amount will be decided upon by the Treasury Department if the package passes. The House version of the local and state government funding bill has very broad and flexible language about what we can spend the money on. Funds can be used for COVID response or to replace lost city revenue. There's no deadline by which we need to spend the money. And again, I just want to emphasize again that this is likely the last flexible local government funding coming from the federal government. And then we anticipate revenue decreases. The community needs to last for several years. So again, we need to make this money last us for a while as well. We expect the amounts and programs in the House package to change in the Senate. For example, the Senate parliamentarian ruled that they cannot include a minimum wage increase in the budget reconciliation bill. And so we're hearing that that piece has been removed. We're also hearing in the Senate that there are calls to put additional guardrails around the state and local government funding. So we anticipate that there might be additional restrictions on what we can use that money for. And then finally, some of the program rules will also be subject to future guidelines from the administration, similar to how the CARES Act funding was rolled out. We'll continue to keep council informed as Congress finalizes negotiations on the package. And then lastly, the team asked me to share some good news. So we recently found out that the US Department of Commerce awarded $1.17 million in CARES Act funding to OED. The grant supports recovery services for small businesses and manufacturers and builds long-term economic resilience. OED will fund community-based business support providers and oversee mentorship and guidance provided by San Jose Downtown Association and Manufacturers San Jose. So with that, I think I will pass it over to the communications team for their update.
I'll take it actually, Benna. Thank you very
Okay,
much.
thank you.
And thank you for all your team's work making sure that San Jose's voice is heard in Washington during this critical negotiations. Next, it's my pleasure to introduce Carolina Camarena, our both Emergency Public Information Officer and Communications Director. Carolina and her team have crafted an approach that starts with the people who need to be reached the most, where they are, and in the languages that they think and speak most comfortably. And I think this approach is bearing fruit. She'll walk you through the details of that and the results of her and her team's effort in this presentation. Take it away, Carolina.
Thank you, Kip. Hello, Mayor and Council. I'm Carolina Camarena, Director of Communications in the City Manager's Office and Co-Director of the Emergency Public Information Branch and the EOC. I'm here today with my colleague, Colin Haney, and we will be talking to you about our COVID response communications to date, some lessons learned, and our next steps. So I'd like to start with a quick recap of what we've shared with you over the past 7 months. In early fall, we outlined a strategic communications plan, explaining that we would focus our content and budget on the people and businesses in our hardest hit zip codes and our monolingual non-English speakers. We really had 4 goals at the time. 1, to change awareness, attitudes, and behaviors, to slow and reduce the spread of COVID-19, and support our most at-risk people. To provide information through a variety of accessible channels on vital resources that support our most at-risk people and businesses. To promote community and economic recovery resources. And finally, the 4th, to educate and prepare small businesses to protect the safety of the community and their employees. Essentially, we planned a public health campaign that typically takes years or even decades to change behavior. Now, given that we expected the expiration date of the federal coronavirus relief funds, we had less than a few months to implement our tactics and a few more months to have those tactics circulate in the community. Next slide, please. Thank you. In late fall, we presented the material we developed. They were trans-created, meaning they were developed in language with cultural sensitivity and relevance, both in the wording and the imagery. Our talented pool of translators from across the city organization who are part of our language access unit within the EPIO were instrumental in this effort, as were the staff at the county and our own content development lead, Chelsea Palacio from our housing department. So we began pushing out our printed and broadcast materials in late October through December. Multilingual bus ads went up on routes traveling in and through hard-hit communities, urging people to get tested and providing a phone number for easy access for those who are not digitally connected. Banners went up at community centers and school sites and our targeted zip codes. I do want to thank the Department of Parks, Recreation, Neighborhood Services, and our Department of Transportation for assisting with those efforts. Ads went up at strategically chosen bus shelters and small billboards around the city in those zip codes. We also had shopping cart ads directing people to testing, but also providing them information on food resources. And those were launched in 4 Food Max stores located in the zip codes that are affected. So a very conservative estimate projects that these ads, the shopping cart ads, were seen by at least 250,000 shoppers. And working with our Office of Economic Development and the Community and Economic Recovery Branch, we reached out to small businesses to offer them A-frames, tent cards, and window posters. As we moved into the state's orange tier in October, Using businesses as a touch points for spreading awareness of health and economic resources seemed a solid strategy for both our community and their employees. Unfortunately, the county health order issued on November 28 and the subsequent state regional stay-at-home order issued on December 17th curtailed our ability to deliver the materials. But in any case, many of those businesses were operating under limited hours and capacity with no use for, say, tabletop materials, and they had minimal contact with customers. But we still had another mechanism to reach people directly. The Community and Economic Recovery Branch dedicated a significant amount of funding to support an additional 2 months of the county's ground outreach, which partnered with trusted community organizations like Somos Mayfors in those highly impacted codes. So we continued with our campaign through the ethnic broadcast, print media, and online. We know that we are reaching our target demographic through both quantitative and anecdotal evidence. For example, the Community and Economic Recovery Branch heard from some of our target businesses that they received and appreciated multilingual information about financial assistance and other resources they were receiving from the Office of Economic Development. And our partners in the county confirmed that our materials were driving anywhere from 30 to 80 additional phone calls a day seeking information about quarantine and isolation support services. And those calls were for monolingual, non-English speakers. Now I'm going to go ahead and hand it over to my colleague, Colin Haney, and he's going to go ahead and take us to the finish line.
Thank you, Carolina. Thank you, Mayor and Council. I'm Colin Haney. I'm the co-lead of the EPIO. I wanted to talk about some of the quantitative data. We've done an extensive analysis of the impacts of our digital, broadcast, and print media. Using conservative estimates and projections from our media vendors, I'd like to share just a few examples of what those tactics have achieved. We've seen roughly 34.4 million impressions through print media. Trilingual ads make up the bulk of that at 22.8 million. Spanish monolingual ads account for 7.6 million of those impressions, Vietnamese 2.3 million, and Chinese 1.5 million impressions. 24.1 million of those impressions were in our target zip codes. A digital package that we purchased through Univision yielded 343,000 impressions through Euphoria digital music streaming service, 1.1 million impressions on Univision TV, and 72,000 impressions through radio stations KSOL and KBRG. We also place Facebook and YouTube video ads, pushing people to our virtual local assistance center, which is updated regularly and contains help for residents, businesses, renters, homeowners, immigrants, and more. The ads ran in 3 languages, and the increased page views for our Spanish, Vietnamese, and Chinese VLAC pages between 500 and 700% between November and December. We reviewed a lot more data than that, and the conclusion that we've come to is not terribly surprising. To reach a diverse community, you need diverse tactics. Most people, sadly, aren't following the city on social media. So let's run ads before the YouTube video that they do want to watch. If someone isn't online, well, maybe we can catch them on TV. If they can't watch TV because they're at work, maybe they're listening to the radio. Or maybe we can catch their attention while they're on the way to work with a fence banner or a bus shelter ad or a billboard. This omni-channel approach is more successful than the sum of its parts. Next slide, please. But none of this has happened in isolation. Our partners at the county EPIO have managed a wide-ranging campaign as well, and they've been excellent at sending out translated digital outreach toolkits weekly for other agencies to use. On the ground, 9 of our own code enforcement officers have been visiting small businesses since the beginning of February, primarily in an advisory capacity. They've talked with business owners about health order requirements, distributed our business resource toolkit brochure, which is essentially our business resource website in physical form, provided restricted capacity signs for them to use, as they found that that was one of the most common violations of the county health order. This effort's focused primarily on the most trafficked areas in the most vulnerable zip codes and census tracts. It included Eastside San Jose, Grand Century Mall, and smaller retail districts in Council Districts 3, 5, and 7. As of February 25th, our code enforcement officers had conducted visits to over 1,200 businesses. Our EOC outreach and education team is now also visiting small businesses with the help of multiple council office staffers. And thank you very much for assisting with those staffers. They're distributing the tent cards, A-frame signs, and posters that had been previously scheduled for distribution. And they're also bringing preparedness kits, which include a mask, hand sanitizer, resource information, and now vaccine information. And our Office of Economic Development has been a lifeline to small businesses throughout this crisis. We work closely with them. Their information goes out through our communications, and in turn, our communications point business owners to their online and phone resources. A postcard that we sent out to small businesses got us a 75 to 100% increase in calls to their resource phone line the very next week. Likewise, they are hosting our customer safety toolkit on the SJ Economy website so businesses can help us share health messaging and other communications with their employees and customers. Next slide. Now, as you all know, our challenge is to use these tools and more to get vaccines in the arms of those who need them most. These maps, COVID spread on the top and vaccine distribution on the bottom, highlight the significant disparities between communities and illustrate how important it is to get people the information they need so they can take advantage of the vaccination opportunities as they arise. Of course, communication can only go so far. There needs to be sufficient supply of vaccine, nearby vaccine sites, and transportation to those sites. With the first round of phone banking complete and more underway right now, we're planning for another round of media buys that will include ethnic radio and TV. We'll also rely more on direct mail this time, sending out updates to households as vaccine eligibility changes. We can focus this distribution even more precisely now that the county is tracking data by census tract and providing it publicly. As new vaccine clinics open or no-shows leave clinics with unused doses, we will micro-target communities with messaging to make sure these opportunities are not wasted. And this is an area where we really need your help, council members and mayor. Through those small-scale community vaccine clinics are open to any eligible member of the public. They're located with the intention of serving the surrounding community. The situation is too dynamic for print and broadcast communications. And though online outreach is quick, it's nimble, but it's less likely to reach our target communities. So we've begun reaching out to your offices with developments as we hear about them from the county, vaccine opportunities, no-shows, asking for your assistance reaching the surrounding community. By tapping into your existing networks and supplementing that outreach with targeted announcements on Nextdoor from us, we hope to bring awareness of these local resources to the communities they are intended for in a timely way. Thank you very much for your ongoing assistance throughout this enormous challenge.
Thank you, Colin. Thank you, Carolina. And with that, that is the end of our presentation. I'll turn it back to you, City Manager Dave Sykes.
Yeah, thank you, Kip, and thank you to everyone who presented. Mayor, we're available for questions.